Bismillahirrahmanirrahim. Today my topic of presentation is mumps. Quote of the day. The miracle is not that we do the work but that we are happy to do it. Learning outline. Outline of today's presentation is introduction, epidemiology, clinical features, complication control and treatment and prevention of mumps. By the end of this presentation, participants will be able to describe the introduction, epidemiology, clinical features, complication control and treatment and prevention of mumps. Mumps, which is also known as infectious parotitis, it is actually acute viral infection of paramyxovirus family. Prior to vaccination, it was a common childhood disease worldwide and it is still a significant threat to health in the developing world. It is characterized by swelling more commonly bilateral than unilateral of parotid salivary gland. The incubation period of mumps is 14 to 21 days and it is communicable from 6 days before to 9 days after facial swelling is apparent. And it can lead to sterility, brain inflammation, or deafness. Now come epidemiology. If we see epidemiology of mumps, a distribution by time, place, and person. By time, it high prevalence is in winter and spring season, and by place, it is due to overcrowding and poor nutrition. By person, 85% of infection of mumps occur in children under 15 years of age. Immunity. Children under 6 months are immune because of maternal antibodies and lifelong immunity after one attack of mumps. Determinants. The primary determinant or causative agent of mumps is myxovirus parotitis, which is an RNA virus of myxovirus family. And secondary determinants may be overcrowding, poor nutrition, winter and spring season. Frequency. Mumps is endemic in large cities. Cases occur throughout the years. Outbreaks are serious and frequent, and in aggregation of young adults, especially in military barracks and hostels. Mortality rate is negligible. If we see the source of infection of mumps, it may be clinical and subclinical cases. Period of communicability 5 days before and week after the onset of symptoms. Modes of transmission. There may be direct transmission and indirect transmission. Direct transmission is contact with infected person by droplet infection, and indirect include freshly soiled articles with saliva of infected people. The mumps virus replicate in the upper respiratory tract and is transmitted person to person through direct contact with saliva or respiratory droplet. The risk of spreading the virus increases the longer and closer the contact a person has with someone who has mumps. Therefore, the infectious period is considered from 2 days before to 5 days after the parotitis onset, although virus has been isolated from saliva as early as 7 days prior to and up to 9 days after parotitis onset. Mumps virus also has been isolated up to 14 days in urine and semen. When a person ill with mumps, they should avoid contact with others from the time of diagnosis until 5 days after the onset of parotitis by staying home from work or school and staying in a separate room if possible. Reservoir, it is a human being. Incubation period is 12 to 26 days and usually it may be 18 days. Infective material includes saliva of infected person, swabs taken from body surfaces of infected person, blood, urine, and human milk. Clinical features. It is asymptomatic in 30 to 40% of cases and it includes prodromal period of malaise, anorexia, fever, and sore throat. There is pain and swelling in either one or both parotid gland, but may also be in both sublingual and submandibular gland. Here, on the affected side of the parotid gland, there is also pain and stiffness on the opening of mouth, and swelling is in front of the neck, and which usually subsides slowly over 1 to 2 weeks. Mumps is actually the MMR vaccination the best way to protect against mumps, and because mumps can be serious and it can cause complication including swelling of various testicle and ovaries. And it is also a disease which is known as best also known as puffy jaw or swollen jaw. Therefore, complication of mumps happen more often among adults than children and may include meningitis or encephalitis, which is the inflammation of membrane that covers the brain and spinal cord or inflammation of brain. orchitis, which is inflammation of one or both testicle in case of males, mastitis, inflammation of breast tissue, parotitis, inflammation of one or both parotid glands, oophorytis, inflammation of one or both ovaries in female, pancreatitis, or inflammation of pancreas or ductness. Although the complications are very rare in case of mumps, but the most commonest complication which is reported is orchitis or oophorytis in male and female. Diagnosis. It includes physical examination usually, and there may be also uncertainty about diagnosis. Test of saliva and blood is PCR. CDC recommend that a blood specimen, buccal and oral swab be collected from all patients with clinical feature compatible with mumps. And recommendation stand mainly for epidemiological surveys. Treatment. There is no specific treatment for mumps. There should be rest, healthy, soft diet, and analgesic in case of pain. Period of communicability. It may be 7 days before clinical onset, persisting to 9 days, but no longer than swelling of salivary gland. Susceptibility and resistance. Generally, secondary attack rate is rare, and one attack usually gives the lifelong immunity. Methods of control. Control of patient contacts and immediate environment. There should be isolation for 9 days, and there should also disinfection. Prevention. The most common preventive measure against mumps is vaccination, invented by American microbiologist Murine Elman at Mark. Given as separately as a part, given as a separately or as a part of MMR, which is known as measles, mumps, and rubella. WHO recommend in all countries with well-functioning childhood vaccination program MMR. Vaccination it include active or passive. Active is actually the mumps vaccine, which is live attenuated vaccine, which is available as single as MMR, measles, mumps, or rubella. Single dose includes 0.5 ml and route of administration is intramuscular between 12 to 15 months of age. It produces 96% antibodies in recipient, and the second dose of MMR should be given in routine at age of 4 to 6 years. Passive immunization include immunoglobulins which are available but not effective. Contraindication and precautions of vaccination. If there is severe allergic reaction to vaccine component of following a prior dose, pregnancy, immunosuppression, moderate or severe acute illness of other etiologies. If we see the CDC guideline, the best way to prevent the mumps is to vaccinate it against the disease. And the mumps vaccine are usually given as combined measles vaccine. 2 doses are recommended before a child enters school. 1 dose given between the age of 12 and 15 months, and second dose is given 4 to 6 months. College students, international travelers, healthcare workers in particular are encouraged to make sure they have 2 doses of MMR vaccine. A single dose is not completely effective at preventing the mumps. Routinely, 2 doses are recommended, but if in the case endemic area or when there is a case of outbreak, a third dose of vaccination is not routinely recommended, but doctor might recommend a third dose if you are in area that is experiences any outbreak of mumps. And also a study of recent mumps outbreak of college campus showed that students who received third dose of MMR vaccine had much lower risk of contracting the disease. Therefore, MMR vaccination is the best protection against mumps. Those who don't need MMR vaccination include who had 2 doses of MMR vaccine after 12 months of age, who had 1 dose of MMR after 12 months of age, and if the child is preschool child or an adult who is not at high risk of measles or mumps exposure. Have blood tests that demonstrate immunity to measles, mumps, and rubella. If the people were born before 1957, because most people in that age groups are likely infected by the virus naturally and have immunity. And also the vaccination is not also recommended for people who had life-threatening allergic reaction, particularly antibiotic neomycin, pregnant women, people with compromised immune system. Those who should get the MMR vaccination include the criteria are non-pregnant women of non-childbearing age, attend college student or other post-secondary school children, work in a hospital, medical facility, a child care center, or school, plan to travel overseas like a cross. Those who should wait to get the MMR vaccination, consider waiting if you are moderately or severely ill, wait until you recover. If you are pregnant, wait until you give birth. Those who should check with their doctors for getting vaccinated: if you have cancer, have child blood disorders, have a disease that affects your immune system, such as HIV or AIDS, are being treated with drugs such as steroid that affect your immune system, have received another vaccine within the past 4 weeks. As it is seen in Pakistan immunization schedule, this is a given. And the national immunization program has contributed significantly, decreasing childhood morbidity and mortality due to vaccine preventable disease. A child need only 5 visits during the first year and 1 visit during the second year. He has to complete the vaccination with 6 visits against the 9 dreadful disease. And measles vaccination is given. Measles 1 in given 9 months and measles 2 given 15 months. Mumps surveillance. WHO recommends following case definition for mumps surveillance. A clinical mumps, acute onset of unilateral or bilateral tenderness, self-limiting swelling of parotid or other salivary gland lasting 2 or more days and without other apparent cause. Laboratory confirmed mumps: a patient with clinical mumps and laboratory confirmation by positive mumps IgM antibody or seroconversion 4-fold or greater rise in mumps IgG titer, or isolation of mumps virus from saliva, urine, or CSF. Epidemiological confirmed mumps: patient with clinical mump who is epidemiologically linked to laboratory confirmed mumps case. Mumps control. It is difficult to control because the disease is infectious before diagnosis is made. Cases should be isolated till manifestations subside. Disinfection we can control through high routine coverage. Program should aim at infant coverage of more than 90%. Low immunization coverage may reduce the number of cases in infant but fail to interrupt circulation of mumps virus in the community. Now, recent updates. A study is published in 2020 which discuss about current status of mumps virus its epidemiology, pathogenesis, and vaccine. According to this article, mumps is an important childhood infectious disease caused by mumps virus. They reviewed the epidemiology, pathogenesis, and vaccine development of mumps. And previous study identified the keywords mumps epidemiology and searching the Medline, PubMed, Web of Science, Google Scholar, and Embase. The number of, according to this article, the number of cases caused by mumps virus decreased steeply after the introduction of mumps vaccine worldwide. In recent years, a global resurgence of mumps cases in developed countries and cases of aseptic meningitis caused by some mumps virus strain have renewed the importance of mumps virus infection worldwide. The performance of mumps vaccination has become an important issue for controlling mumps infection, according to this article, and vaccine development and routine vaccination are still effective measures to globally reduce the incidence of mumps infection. During outbreak, a third dose of MMR vaccine is recommended for groups of persons determined by public authorities. Another article also published in 2020 Journal of Immunological Research, which assesses the change of mumps characteristics with different vaccination strategies using surveillance data and importance to introduce the second dose schedule in China. According to this article from background from 2005 to 2016, the prevention and control of mumps in China have undergone 3 stages of transition. These include the use of mumps vaccination is a virus as a self-supported vaccine, the introduction of 1 dose of MMR to EPI on immunization, and administration of 2 dose mumps vaccination following supplementary immunization activities using MM. However, using surveillance data, they assess the epidemiological of mumps during 3 stages. Methodology: children in China born from 2005 to 16 and registered in Zhejiang provincial immunization information were included. They analyzed the epidemic data and calculated incidence from 2000 incidence in 3 birth cohort in 2005 to 6 to 7 to 10 and 2011 to 2016, with incidence include 51.57, 41, and 12 per lake population per lake individual respectively. And the highest incidence was in children was reported in 6 to 14 years of age from 2005 to 16, and of which majority were school children. And approximately 90% of reported outbreaks occur in school children, primary school or middle school. and the seasonal characteristics of mumps were less obvious from 2011 to 2016. And the coverage of one dose MMR in 2000 birth cohort was 71%, and the 22 and 26 to 20 birth cohort, the coverage of one dose was 96%, and then the coverage of two doses was 17%. The children born from 21 to 2016 cohort were only pre-vaccinated with MMR, and the coverage of one dose was 99%. Therefore, the study concluded that the mum incidence in the three birth cohorts significantly declined when they were increased vaccination coverage, except the children less than 2 years old. The mum incidence for the child born from 26 to 2010 was higher than that for children born from 21 to 2016. And this study concluded that the mum incidence significantly declined following the introduction of one dose of MMR. And therefore, they concluded that supplementary immunization using lead to rapid reduction of mumps cases. Therefore, they recommend a two-dose of vaccine routine immunization schedule and improve vaccination coverage in order to reduce the incidence of mum cases. There is also another article published which include introduction of two-dose mumps containing vaccine to routine immunization schedule using a Cox proportional hazard model. In this disease, they analyzed the influence of different doses of mum containing vaccine against mum using Cox proportional hazard model. They collected 909 mumps cases of children who were born from 26 to 2010 and vaccinated with different stage of mumps containing vaccine in China during 2016 to 18, which are all clinically diagnosed. The plan, mere survival methods, and Cox proportional hazard model were used to estimate the hazard probabilities. According to this study, it showed that the cumulative hazard of male and female has no difference. Lower hazard was detected among those who were vaccinated with two-dose mumps containing virus vaccine born in 2006 and infected after supplementary immunization activities. And this regression hazard analysis suggested that after onset of supplementary immunization born in 2006 and vaccinated two doses of mumps containing virus containing vaccines are protective factors against infection even after adjusting the potential confounding factors. And studies suggested that it was necessary to revise the diagnostic criteria of mumps and identify rapid test PCR as a standard for mumps diagnosis. And they suggest that routine immunization schedule should introduce two doses of MMR and pre-vaccination screening should be performed before booster immunization in vaccinated population. Now multiple choice question. MCUs 1. Mum is a viral disease caused by mum virus. Initial symptoms are non-specific and include fever, headache, malaise, muscle pain, and loss of appetite. Which of the following are the local symptoms of mumps? Alpha is swelling of adrenal glands, beta swelling of pineal glands, C swelling of thyroid gland, delta swelling of pituitary gland, E swelling of salivary gland.
E.
Yes, E will be the correct option. Swelling of salivary gland. Actually, mum is the swelling of salivary gland, which is the parotid gland. MCQs 2. If an XYZ person has mum and he should stay away from home and work and school and is possible stay in separate room from other people from the time of diagnosis until how many days after the onset of parotitis? Alpha 8 days, beta 10 days, C 5 days, delta 15 days, and E 12 days.
E.
B.
C will be the correct option, as I already mentioned in mode of transmission that if the person has mumps and he should stay away from the work or school or possible in separate room from other people from the time of diagnosis, he should away from 5 days after the onset of parotitis. MCQ 3. Patient known or suspected of being infected with respiratory infections transferred by respiratory droplet produced by cough, sneezing, or talking patient. Which of the following disease is not transmitted by infected droplets? Alpha chickenpox, beta measles, C mumps, delta poliomyelitis, E rubella.
Delta.
D.
Delta will be the correct option. That the poliomyelitis is not transmitted by infected droplets, As already I mentioned that the chickenpox, mumps, measles, and rubella are the respiratory tract infections transmitted to respiratory droplets. Therefore, delta will be the correct option. That is no transmit to infected droplets. MCQs 4. A 10-year-old child boy presented to medicine OPD with complaints of pain in the front of neck, difficulty in chewing, fever, headache, and malaise. Malaise, fever, and malaise, and ashes for the preceding 5 days. The following is the most common cause of this condition: alpha measles, beta mumps, C rheumatic heart disease, delta rubella, and E tonsillitis.
Beta.
B.
Beta will be the correct option as the child has swelling in front of the neck and there is difficult chewing, fever, headache, and muscle ache. Therefore, the most likely diagnosis or common cause for this condition is beta is mumps. MCQs 5. Mumps complications are uncommon, although some are potentially serious. Commonest complication of mumps is alpha encephalitis, beta myocarditis, C orchitis and oophorytis, delta pancreatitis, and E pneumonia.
C.
C.
C will be the correct option as orchitis or oophorytis are the complications which are seen in the male and female, but this complication is very rare. MCQ 6. The most effective approach to avoid mumps is to be vaccinated. Once completely vaccinated, most people are immune to mumps. Route of administration of mumps vaccine is alpha intracutaneous, beta intradermal, C intramuscular, delta intravenous, E oral.
A.
C. C.
C will be the correct option, intramuscular. MCQ 7. Mumps normally passes without creating major health problems. Serious complications are uncommon or rare. If the affected person has gone through puberty, male adults with mumps may on rare occasion encounter alpha mastitis, beta oophorytis, C orchitis, delta salpingitis, E vaginitis.
C.
C.
Yes, the correct option orchitis. Male adults, mumps or rare occasion encounter the orchitis because as it is a complication seen in male and all other complications are seen in females. Therefore, C will be the correct option. The inflammation of testicle, which is very rare complication also. MCQs 8. For the past 5 years, there had been a huge number of mumps outbreak at ABC cities, XYZ College. In order to prevent the mumps, students are encouraged to make sure that they have had dash doses of MMR vaccine. Alpha 1 dose, beta 2 dose, C 3 doses, delta 4 doses, and E 5 doses.
Beta.
2 doses. B.
C will be the correct option as the students are encouraged to make sure that they have 3 doses of MMR vaccination in case of outbreak area because 2 doses are mostly recommended, but WHO series recommend the third dose if any students or um, an area this high huge number of cases of epidemic. Therefore, there should be 3 doses in case of outbreak in any area in order to prevent further to decrease the risk of mumps. MCQs 9. Newborn is protected from developing mumps uh, after but how long? Alpha 1 month, beta 2 months, C 3 months, delta 5 months, or E 6 months.
6 months.
E. 6 months.
Okay, 6 months. The correct option is E 6 month. As I already mentioned, that newborn is protected from developing mumps after but 6 months. MCQs 10. A preschool children migrated to an XYZ city with a low probability of exposure to mumps or measles there. A child had received already 2 doses of MMR vaccination between the age of 12 to 15 months of age. Currently in situation of requirement, the child Alpha should receive one additional dose of MMR. Beta should receive two additional doses. C should receive no additional dose. Delta should receive four additional doses. E should receive three additional doses.
C.
C.
C will be the correct option. That child should receive no additional dose. As I already mentioned that if a child has received two doses of MMR vaccination between the age of 12 to 15 months of age, and he or she is migrated to any area where there is a decreased probability of exposure to mumps or measles, therefore WHO series recommend that there is no need to receive another third additional dose of MMR vaccination. Therefore, C should be the correct option. That child should not receive any additional dose of MMR vaccination. This is the key of my slide and MCQs, and thank you.
Thank you very much, Dr. Khansa. Very nice presentation as always. There are many important things, especially the study you have presented from China that has really very nice presentations of moms, as well as how the different methods should be adopted to control and how they have controlled it to after 2016 in the cohort that is born after it. My question would be WHO recommendations for the mom surveillance and how the cases has to be defined. Have you presented it, Dr. Khansa?
Yes, madam, I have already mentioned a few definition confirmed case, laboratory case diagnosis of WHO. This is mom surveillance and case
Would you
definition.
please go to that slide?
Yes, madam, this is clinical WHO following case definition for mom surveillance. A clinical mumps, which is acute onset of unilateral bilateral tenderness, self-limiting swelling, or lasting 2 more days, and then laboratory confirmed mumps, a patient with clinical mumps and laboratory confirmation of positive mumps IgM antibody, or seroconversion with 4 for greater rise in IgG titer. And then epidemiological confirmed mumps, patient with clinical mump who is epidemiological linked to laboratory confirmed mumps case. These are some case definitions which are given by WHO.
Thank you very much. This is very important because surveillance of the moms, that is the most important thing that reduces both clinical as well as the confirmed cases of moms. The control of moms, we know it is difficult because the disease is infectious before diagnosis can be made. So it is having a very variable incubation period. And we also know that the subclinical cases makes it very difficult to control the disease. So the surveillance systems has to be strengthened, and the cases should be isolated till the clinical manifestations subside. And the steps should be taken to disinfect all the belongings of the patient, and the contact should be kept under surveillance. And this surveillance system has to be strengthened in every place for the mumps eradication. However, we know that this is something that is in near future we would be able to control many infectious diseases. As far as your one of the chat in the chat, it has been written about the breastfeeding. Yes, breastfeeding is very safe after mom's vaccine. However, the mother who is having the symptoms of mumps, she has to use all the precautionary measures like mask, etc., while doing breastfeeding. Otherwise, both the vaccine as well as the mother who is having the mumps manifestations, subclinical or clinical, they should breastfeed their child. Second important thing is about the complications in your slide number 7, MCQ number 7, please. Okay, it is about the complications of mumps in male, and we know that there are the male can't have oophorytus and orchitis and salpingitis or vaginitis. However, the testicular swelling and tenderness, that is the part of orchitis. That is the most common extra salivary gland manifestation of mumps in adults. So the unilateral is about most common part, that is about 75%. So this MCQ is a very important MCQ, and very important information has been given. And this orchitis later on converts into infertility and can later causes the sperm count to be declined, and later in life they can have difficulty in having children. Dr. Khansa, would you like to add anything in this slide?
No, madam, as you beautifully explained that male adults is common, more common as the complications are very rare in mumps, but it may be occur and very rarely it may occur. It include the encephalitis, meningitis, but the most common complication which is reported under the mumps disease is the orchitis and salpingitis. Orchitis, which is inflammation of testicles in males, and oophorytis, which is inflammation of ovaries in females, and which can lead to infertility problems in both genders.
Yes, although it is rare, and but it is after the salivary glands, it is the most common presentation in males, and 75% have unilateral orchitis. So this is again a very important lesson from today's presentation. Thank you very much, Dr. Hansa. We would stop here, and again, very well done. Allah Hafiz.
Thank you, madam.
Allah Hafiz,
Thank you,
everyone.
ma'am.